Welcome back to the South African Morning. Now, the 4th of February is marked as World Cancer Day. The World Health Organization is leading the cause of, says that the cancer is the leading cause of death around the world. Now, this year's theme is Close the Care Gap. It aims to highlight the huge inequalities in prevention, detection and the treatment of the disease. Let's discuss this further with Professor Michael Herbst from the Cancer Association of South Africa. Many thanks for your time this morning, Professor. Perhaps if you could just paint a very broad picture of the current state of cancer treatment in the country. Is there enough access for people to get the treatment when it becomes necessary?
Thank you very much for the opportunity to visit with you this morning. Yes, unfortunately, it is true that there are so many gaps in cancer care, not only in South Africa, but really in many, many countries of the world. But we have a very sad state of affairs, and really one of the most important ones that we have as a gap is what you have mentioned in your introduction, and that is access. Let me use Charlotte Maxeke Hospital as a start. At the moment, men who report to Charlotte Maxeke Hospital with prostate cancer have a waiting period of 5 years before they can get radiation treatment for their prostate cancer. Now that is really sad that we have reached that stage in South Africa where people have to wait that long. We also know that the same thing applies to people who are diagnosed with breast cancer, with any of the other forms of cancer. We have the gap in that it seems, and I am not the expert on this, but it seems like equipment is not being maintained the way that they should be, that they don't pay the service providers, and then the machines are not serviced and they go out of commission. And then it takes a long time before these apparatus are repaired and people can get the treatment that they are entitled to receive.
That's absolutely worrying. 5 years before someone can get a cancer treatment is actually a very scary thought. And you're talking about the lack of maintenance of equipment and the not paying of service providers, Prof. But who's supposed to be taking accountability here? Where is the oversight? And why aren't we seeing more people being held accountable for what I would say is a human rights violation?
You are so correct. You are asking the right questions. What concerns me more is the inequality of provision of healthcare in South Africa. I'm in a very fortunate position that I can afford to have private insurance, health insurance. So if I have a health problem, I can go to a private practitioner, I can go to a private hospital and get the treatment that I want. But approximately 80% of South Africa's population are dependent on the public health service. They are the ones who my heart goes out to, who really already are suffering because there's such large-scale unemployment. And people cannot afford even to go to a pharmacy to buy headache tablets and things like that. And now to have a serious disease like cancer and not to get treatment, I think it is so unfair. And you are asking the right questions. Who should be held accountable? Who's going to take responsibility at the end? And we've come to the end of the Zondo Commission, and I thought to myself, maybe it's time that we should have a healthcare commission of inquiry. Really, the public health service really needs a little bit of an upgrade.
No, absolutely, Prof. And while we talk about this particular issue, a large part of the treatment of cancer is the early detection. Does this happen a lot in South Africa? I find that many South Africans are not really educated when it comes to cancer and detecting it, should it be within the system. How are we looking on that front?
This is where cancer has decided one of the things we will do to close the gap in cancer care. We've now established a telecounseling service where people can contact the Cancer Association of South Africa on a toll-free line, 0800 22 6622, and they can request a telecounseling session. Cancer will then phone them back, and we have counselors who will be able to answer their questions, to provide them with information that they are asking for, and this service is provided in 7 languages. So we're really very proud that we could, close the cancer care gap, and this is one example of what we are doing.
Right. When we talk about cancer and the gap, hopefully we wouldn't need to be detecting it and rather just preventing it entirely. Talk us through some of those preventative measures that one could take to protect themselves from this horrible, horrible disease.
Yes, of course, we have to realize that one cannot prevent cancer, but we can do a lot to reduce our risk for getting cancer. And there are many of the things that are very well known to us. Let me start, and they're not necessarily in a particular order. Do not smoke. If you are a smoker, please get assistance to get yourself off and to kick this habit. Cancer even has an online kick butt program that we call it, to help people to stop smoking. Do not use alcohol, or if you have to use alcohol, do it very sparingly. Already in the 1980s, it was made clear through IARC, the International Agency for Research on Cancer, that alcohol is a cancer-causing chemical. So try and avoid alcohol. Try and avoid processed foods. And here I'm specifically thinking of things like bacon, sausages, Viennas, eating hamburgers, Russians, and that type of thing. They are preserved with nitrates and nitrites to make them last longer on the shelf. And it is well known that nitrates and nitrites are cancer-causing chemicals. Then we must be as active as possible. This doesn't only hold true for cancer, but for many other diseases. We know that people who are active and keep their bodies active and preventing themselves from becoming couch potatoes, that they fare much better, and it helps reduce the risk of, amongst other things, cancer. Then to eat a very well-balanced diet, making sure that you eat all the different colors of fruits and vegetables, because each of the different fruits and vegetables contain different antioxidants. And those antioxidants are so important to help protect the body against disease and also cancer.
Brilliant. Many thanks for your time this morning, Professor Michael Herbst there from the Cancer Association of South Africa, joining us to speak about cancer in the country. Very, very scary statistics that it could take up to 5 years for a male suffering from prostate cancer, as an example, to actually get the radiation that he needs. I think we really need to get the health department to come and account for these inefficiencies in our health system. I said it a little bit earlier. It's tantamount to a violation of basic human rights.